Think about something that you do every day in your life. Yeah, you probably thought about sleep, taking a shower, go to the university, go to work, and eat. Yes, eat. It is something that we all do, or most of us do every day. But the reality is that most of us do not do that and deal with an eating disorder or vomiting after you eat because you feel guilty, or do not eat because you should look skinny, or yeah, it's a lot of pressure, and eating disorders is a huge problem. What are eating disorders? According to Angela Guarda from American Psychiatric Association in an article of March of 2021 with the name Eating Disorders. Eating disorders are behavioral conditions characterized by severe and persistent disturbance in eating behaviors and associated stress and thoughts and emotions. As a teenager, I realized that there are a lot of factors that contribute to develop an eating disorder. Like these people who suffer an eating disorder, I think not just me, most of us grew up in a society that idealizes perfection. Everyone wants to be perfect, and the reality is that no one is perfect. There is no person who is perfect. Eating disorders affects all kinds of people, a lot of people, and sometimes we don't even notice it. We should pay more attention to eating disorders and help to prevent them. In this speech, I will tell you some basic things that we should know about eating disorders, like the causes of eating disorders, the common types of eating disorders, the kind of people who are most likely to be affected by an eating disorder, and the prevention for an eating disorder. First, I would like to begin by talking about the causes of eating disorders. By recognizing the causes of eating disorders, we may help to prevent them. And the exact cause of eating disorders is unknown, but there may be many causes or many factors that contribute, like genetics, gender, changes in the brain, body size, body image. This is maybe the most common type or the most common cause of eating disorders. According to Dr. Timothy J. Legg in an article dated December 3 of 2019 on the webpage of Healthline with the name Binge Eating Disorders, Symptoms, Causes, and Asking for Help, it says, people with bad binge eating disorder often have a very negative body image. Body satisfaction, dieting, and overeating contribute to development of the disorder. And another cause could be emotional trauma, stressful life events such as abuse, death, separation from a family member, or a car accident are risk factors. Childhood bullying due to weight may also contribute. Now, in my main point, number 2, I have the common types of eating disorders. Not all eating disorders are the same. All the eating disorders are different in some way. The effects that have in the body are different. According to Claire Howard from Mental Health First Aid.org in an article dated May 10 of 2018 with the name 3 common types of eating disorder. The most common eating disorders like anorexia, bulimia nervosa, and binge eating disorder affect up to 30 million people in the United States. Can you imagine? 30 million people in the United States are suffering eating disorder right now. And yeah, These are the three most common types: anorexia nervosa, bulimia nervosa, and binge eating disorder or BED. Now, in my main point, number 3, the kind of people who are most likely to be affected by eating disorders. First, I just want to say eating disorders can affect anyone in the world. Anyone, I mean, no matter gender, race, nationality, etc. But there are some vulnerable groups who are most likely to be affected by eating disorders. According to mentalfirstaid.org, in an article dated February 12 of 2010 and 20, with the name 7 Things That You Need to Know About Eating Disorders. Eating disorders affect all ages, gender, races, and cultures. They are 2 or 3 times more common in females than in males. The median age for eating disorders ranges from 18 to 12 years. Half of the people have onset before these ages. And now, my last main point, the prevention of eating disorders. Prevention is one of the most important things. If we help to prevent eating disorders, we could help to save many lives. Even if there is no exact cure or way to prevent eating disorders, there are some things that might help to prevent eating disorders. Why is prevention an important goal? Well, according to Melissa Atkinson, in an article published of 2015 in the International Journal of Eating Disorders with the name Mindfulness-based Prevention from Eating Disorders, a school-based cluster randomized control study, mindfulness-based eating disorder prevention say, successful prevention of eating disorders represents an important goal due to damaging long-term impacts on health and well-being, modest treatment outcomes, and low treatment seeking among individuals at risk. According to the Mayo Clinic Foundation, there are some measures that we could take to prevent eating disorders, like avoid dieting around your child, talk to your child, cultivate and reinforce a healthy body image, enlist the help of your child's doctor. As you heard, there are these measures that we could take since childhood to prevent an eating disorder in the future. Remember that there are always something that we can do to help others. But first, we need to know more about the topic so we can help other people. In conclusion, I explained the possible causes of eating disorders, the common types of eating disorders, the kind of people who are most likely to be affected by eating disorders, and the prevention of eating disorders. We should give more importance to eating disorders, help prevent them, and help those dealing with an eating disorder right now. If you know someone who shows signs of an eating disorder, consider talking to that person and encourage that person to look for professional help.